40 years. Wait a minute, I gotta say got it.
Yeah.
I've been involved with the foundation for about 40 years. One of my good friends from high school, David, has a daughter with CF. Her name is Amy, and I'm allowed to share his story or their story. And I've been on the journey with them uh, throughout Amy's life, to be honest. We started a golf tournament right after she was diagnosed. She was diagnosed when she was about three. Um, been through ups and downs. David had called me and wanted me to get her an appointment at Vanderbilt and scare her. And I said, if she's not doing her treatments, I won't have to do anything. They'll put her in the hospital. So they did for about 2 weeks. Amy didn't speak to me for 2 years. So we've gotten over that now. And then been through the whole gamut of Orkambi didn't help, Symdeco didn't help, but Trikafta has been a game changer for her. And she's doing really well on Trikafta. She's married. And we're hoping that the Trikafta baby boom will affect Amy in the long run. So that's my background. I've been with the foundation for about 20 years. The last time I was in Heart of America, I finally got to Kansas. It was kind of funny. Every time I came to Heart of America, I'd go, am I in Kansas? And they're like, no, you're in Missouri, because I never crossed the river. So the last time I was there, I actually got to go to Wichita, which is 3 hours from Kansas City. And it was funny, right after that trip, I ended up getting Missouri. So now I have Missouri. And I never knew that Kansas City, Missouri was actually in Missouri. I thought my chapter was in Kansas the whole time. So that's a little bit of background on me. I actually live in Tennessee, south of Nashville in Franklin, Tennessee. So just want to kind of give you a little bit of a science update. I'm not a doctor. I don't pretend to be. But if you have questions that I can't answer, I will certainly find out the answers for you. Please interrupt me, come off screen, or type something in the text. Marin's going to monitor that for me, so I'll make sure to answer questions. And if I don't know the answer, I certainly will find out for you.
Great.
So, Marin, if you want to start my slides,
Yep, absolutely. Share my
I'm
screen.
not used to not seeing people.
I
Y'all
know.
are all too
Yeah,
shy.
just like Brian said, please pop on screen. This is a very casual opportunity to meet grandparents and grandparents from all over the place. So we love to see you. And like he said, I will monitor the chat and feel free to drop questions or comments in there as Brian's presenting. And as he said, we will do our best to get questions answered if we don't have one for you. So.
And before we start, since Charles kind of popped on, I'm just going to put him on the spot. I know his story, but if the rest of you could tell me if you have a grandson or a granddaughter and whether they're on Trikafta, if y'all would come off mute and show yourself. Dan, it's hard to figure out how to unmute because I had a problem with that earlier.
I think I got all. Am I on there?
Yep, you're on there.
Dan Swick. I'm in Fairfax. I have three grandchildren with CF, and my wife and I are active with the foundation as well.
So is Fairfax in Kansas?
Fairfax, Iowa,
Iowa. Okay.
right next to Cedar Rapids, pretty close
Well,
to Cedar
I don't
Rapids.
have Iowa yet, so I guess I better be careful what I say on this call. Brian and Mary, you want to tell me a little bit about you guys?
Hi there. Brian and I are grandparents of our 12-year-old granddaughter. She has cystic fibrosis, and she was put on Trikafta. I think it's been about 2.5 years. She's doing remarkable. We are so thankful. It is such a godsend. She's doing really, really well, playing in sports and um, eliminating a lot of her medication. She's gained weight now and just really, really looking good. So yeah, we're really grateful.
Yes. Okay, good. And Charles, I didn't want to take the thunder away from you, so go ahead and tell us about your grandson.
Oh, okay. Well, I'm Charles Harrison. I'm from Tulsa, and I have an 8-year-old grandson, Owen, who has CF, and he has been on Trikafta, and he's been doing very well on it. So we're very appreciative of the foundation.
And Dan, you said you had three grandchildren with CF. Are any of them on Trikafta?
Yes, all three of them. I have
Okay, good.
the oldest is 6, going to be 7 in December, and then he has 3-year-old twin brothers.
Oh,
And
wow.
they
Okay.
just started the trikafta, so yeah, it's been a heaven sent for them too.
Okay, good. Shelby, you want to come off mute and show yourself? Looks like Lori's trying.
Yep, I'm trying.
Shelby, we can see you now.
Okay, good. Let's see if I can turn off. Oh yeah, we turned it. So we're in Nebraska. We're having a little in-person
I
Grampians.
recognize y'all.
So I'll let these two that are no, these two are not going to introduce themselves. But we've got a big group. We have, I mean, they're all grandparents. Got 7 people in here. There's
Oh, wow.
7. There's 7 total CFers, right? No, you have 3.
I have 3.
So like 10, 11.
Wow.
Wow.
They've got some questions.
Okay.
They came prepared, Brian. So be ready.
Who's next? Lori?
Okay, I don't know if it's working again.
We can hear you, Lori.
Yeah, we can hear you.
Okay. Yeah. I am from Wausau, Wisconsin. I have a grandson with CF, and he was born in June.
Okay. What day in
And-
June?
Pardon?
What day in June?
The 2nd of June.
Mine's the 9th, so I was just asking.
And I also have another grandson who is a carrier.
Okay.
And that was kind of how we first found out that it was kind of in our family, but he turned out to only be a carrier. So we had a bunch of other family members kind of get tested, so we knew who the carriers were.
Okay.
And he's doing really good so far, although he has a cold, I guess, this week.
Yeah. So he's what, 6 months old, or no, he's not June, July,
5.
August,
Yeah.
5 months. Okay. Constance, it looks like you have unmuted. Do you want to tell us a little bit about yourself and how you're in the Grampians?
Yes, I'm Connie, if you would call me by
Connie.
Connie, please.
Okay.
We have a grandson, Fisher, who is 13, who has cystic fibrosis, and he is also on trikafta and is doing extremely well, also very active in about every sport. And we are also very thankful for the work the foundation does. And I live in central South Dakota.
Okay.
Grandson lives in Rapid City, South Dakota.
When you said South Dakota, I knew that's where you were from, Connie.
It's a good giveaway.
Claire, do you want to unmute and tell us a little bit about your story? I'm just going in order on my screen. Sorry, oh, there you are. You've switched to the other side.
I am the other side of the Nebraska Grampians group.
Okay.
So I don't know if we've met Brian, but I'm the newest Nebraska staff member.
Oh, okay. I have not met you.
Yeah. So
Welcome aboard.
thank you. Yeah. Okay. I will mute.
And then is Jackie, can you unmute? She's too shy, I guess.
I think that's everyone on my side. Do you see any others? Anyone else want to jump on? Okay, I'm going to share.
Okay.
See if I can get this in present mode. Can you see that,
Yeah, 'cause-
Brian?
Okay. It's not in present mode yet, but
Yeah, I'm going to try something.
okay. Sorry for the black screen. I didn't know how to make it blue.
Oh no, it's just fine. It won't. It's blocking me from picking present mode. So, oh, there we go. Can you see that?
Yeah, that's perfect.
Perfect.
So I know my slide says research update, but this is really y'all's meeting. So, we're going to make it however you want it to be. If I get too sciencey, and it's too much for you, because I know I did a Grampians call a couple months ago, and one of the chairs of the Grampians committee in Tennessee is a physician, and so he wanted me to talk about phage therapy. So I was really prepared to talk about phage therapy, and I lost the whole audience. So I said, okay, guys, we're going to stop this. I'm going to talk to him separately and talk to Dr. Scarborough separately. So we'll just talk about what you guys want to talk about. So don't let me get too sciencey. If that's the case, just kind of pause me and I'll stop. So if you'll go to the next slide. Really, I wanted to kind of give you an update, and this slide has changed since NACFC. So I've got some good news for you. Of course, we've all been saying we have 30,000 children and adults in the United States. Well, now that number is 40,000. And there's over 100,000 worldwide, and we're finding more and more CF patients as we look at nonsense mutations. We found a population in India that we didn't know that we had. And this slide I did October, and based on NACFC, that was just last week in Phoenix, there's now 59.4% of the people in the registry are now adults over age 18. So that just shows that people are living longer, and that we have more adults than we have children. So we're going to see care centers change because there's so many more adults than we did have before. For the first time, the median predicted survival is 56. Based on the meeting that we had last week, it's now 56.6. If a child is born today and is on modulator, the age that they've predicted out is 68.8, which is amazing. That's pretty close to what maybe I'll live to be 70, hopefully. So I think that's some really, really good news. In the past, 200 people with CF reported having lung transplants each year. Last year in 2022, there were only 53. And in 2021, there was only 52. So, I mean, that's some amazing numbers. Trikafta baby boom, there were 675 pregnancies reported in 2021 compared to the highest number that we've had in a while, which is 235 in 2019. In the 2022 numbers, we are at 636. And those numbers just came out today. If you'll go to the next slide, Maren. But one thing that I really want to make sure that people realize is, even though we have therapies for about 90% of our population, we do still have about 10% of our population that does not have a therapy. And what I mean by a therapy is a modulator, because that's not a cure, it's a control. And what we want to make sure that we are doing is keeping our patients healthy until we can get to the genetic therapies, which will be a cure. So my number that I always think about is CF stands for cure found. So we want to find a cure for everybody with CF. And despite the pandemic, we invested almost $254 million in research and care. And in 2022, we spent about the same. And for this estimate this year, we're going to be about $252 million. Of course, we all know that Trikafta has now been approved for children 2 to 5 years old. So that's made a game changer for a lot of our younger patients. And then we also have started this research initiative for infection. And we are already 2 years ahead of where we thought we would be. We actually have spent $135 million on infection research as of now. The path to a cure, of course, is working towards therapies for an all and one-time cure. And a lot of that path to a cure now is genetic therapies. And so we're moving into that arena with genetic therapies with our phase of research. And we're really hopeful that we can find a cure that way. We can actually cure CF in a Petri dish now. That was just announced last week at NACFC. And when I keep saying NACFC, I hope y'all understand that's just our national CF conference that we had last week in Phoenix. There were about 5,000 people there. They were from every part of the world. I got to practice my German last week, a little bit of my French. My French is a little bit more rusty than my German, but there were people from all over the world trying to find a cure for CF. So you'll go to the next slide. This is where our bread and butter is, our drug development pipeline. And when you look at this, the purple is what we call the path to a cure. So we know we have 4 therapies available now, which we have Kalydeco, Orkambi, Symdeko, and of course the big T, Trikafta. We actually have, if you look where my arrow is pointing down, I'm sorry, I'm using my hands. I talk with my hands. Phase 3 is, and I'm gonna have to show my age. I'm gonna have to put my reading glasses on because I can't remember what compound it is. It's a Vertex drug, and they're calling it VX121 plus tezacaftor, which is Trikafta part, and then VX561. This is actually a 1 pill a day regimen. So, and it's also showing a lot more progress for not causing depression in our patients too. So this is doing really well. It's in phase 3. It's almost close to being open label. When I say open label, I mean that there are people who have been on the control or the placebo. The people who've been on the placebo will be able to start taking the drug. The AbbVie drug has been dropped. I thought I'd put a new slide in and I forgot that AbbVie is not on there now. We have another modulator with Elox, and then we have another modulator with Vertex, and then we have another modulator with 4D molecular. So those are the modulators that we have in place right now. If you look at the Acturus and some of the other ones right through here, these are a lot of our gene therapy that's going on right now. Southern Research Institutes, if you look at that, that's in Birmingham, Alabama. A lot of the Splicense is genetic editing. So there's a lot of things going on right here. These, when you see preclinical, we're actually registering people for those trials right now. And we're having a hard time, to be honest, filling those clinical trials because we're doing the trials for patients who don't have a Delta F508 mutation. So we're wanting to do the trials for nonsense mutations first. So these are pretty much all genetic therapies in here. And so that's where we are really looking forward to finding the cure. Now, if you look at the orange, this is our infection research. There's a lot of interesting things going on here. And I know for even myself, I had a really bad sinus infection a few weeks ago, and I was like, please just give me a Zyrtec, or not a Zyrtec, a Z-Pak. No, the reason why everybody's having so many resistance to antibiotics is because we keep taking the pills. And what we've done with CF patients is cause the same issue, that they've become resistant to some of our therapies for infection control. So we actually are doing some clinical trials. One of them is being called STOP. And basically what it is, you know, how you were told, you know, take your drug for 14 days. Doesn't matter if you start feeling better at day 12, you take it to 14, you've got to finish the prescription. Well, now what we're realizing is for some patients, maybe that is 7 days, or maybe that is 9 days or 10 days. So it's called a STOP trial. So that's something that we're working on. And also, since a lot of your patients, and I think most of the kids are fairly young, I think Fisher might be the oldest at 13, I'm not sure. But they're also doing a Simplify study where they're trying to figure out, because a lot of our adult patients, unfortunately, they decided on their own that, hey, I don't have to do this. And so we're actually doing a clinical trial seeing if they can simplify and not do some of the therapies that they were doing before they were on Trikafta. So more news to come on that. So if you look at this orange, there's a lot going on in infection research. Remember, I said we have spent $135 million on infection research. So if you look at the first line, it's going to be complications and looking at symptoms of infections. And I got to cheat again. The second, let's see, the third one, intravenous gallium, is showing a lot of promise. And if any of you remember science class and the periodic table, iron is Fe, gallium is Ga. And what they're doing is gallium is kind of like a Trojan horse to iron. And Pseudomonas attacks the iron in the blood or in the body. And so when they're injected intravenously with gallium, the Pseudomonas attacks the gallium and then it can't survive. So that's a novel approach of something that we're doing besides just taking a pill. If you look at inhaled nitric oxide, which is about 3 down from the gallium, this is kind of like what you would do with laughing gas. It is a nitric oxide that they're actually inhaling. And this is helping with Aspergillus and Pseudomonas infections as well. So we're doing a little bit of different things. And then if you look at APPaO2, which is right after intravenous gallium, and thank you, Maren, you do so well with that arrow. It's helping me out. This is one of our phage therapies for Pseudomonas. And basically what phage is a virus that they inject into the body that fights the Pseudomonas virus and it kills it. So what we're discovering is this phage therapy has been around a long time, but we've just started kind of working with it. So we actually have 2 phage therapies in clinical trials right now. One of them is the one that we're just talking about, and the next one is the next BX004A. And it's also a phage therapy for Pseudomonas. And I'll go a little bit more into phage therapy later, but just wanted to kind of show you that. The inhaled nitric oxide that we were talking about is really for NTM infections. I misspoke and said Pseudomonas, but it's actually for the NTM infections. And then the SPI 1005. This is actually a drug that we're trying to use because a lot of people with antibiotic use, we find over a long period of time, they're having hearing loss. So this is something that we're working on for hearing loss. So that's just one of the side effects of long-term antibiotic use. So we're trying to get people away from taking so many antibiotics. So this is really helping us with those complications and the symptoms so that we can keep our patients healthy. Because as you remember, a lot of our patients don't have a modulator, and some of our patients who are on modulators, Trikafta was not available until 2019. So, we only have about 3 years worth of people who have been on Trikafta, so they have damage. So, we want to keep them as healthy as possible. So, any questions so far? Emotional outburst, or I wish he quit talking about this pipeline. Any chats? Because I can't see chats.
Claire, are you seeing any?
I am not, but Dave has a question.
Okay.
Okay.
You want to ask it?
Yeah, I'll just say my career was in mental health, so I've been very interested in the behavioral health concerns related to Trikafta. Our grandson is on Clydeco, and they've decided to stick with that, until there's more done. I'm really glad to hear about this emerging therapy, but I'm just wondering what kind of research and studies are going into the behavioral health side effects with Trikafta.
Well, I know one thing that they are doing is they're actually adding mental health coordinators back to the teams for the CF care centers. So that is something that we are funding. I think that what they're discovering too now is, along with COVID and the isolation from COVID and then being on the drug, it could be a correlation that it was more of just the isolation part of it. But they are looking at some of our patients who, are taking the 2 in the morning and 1 at night to reducing it to 1 and 1. So they are looking at different dynamics on strength to see if that makes a difference. So they are looking at that. And there is a research study that is going on looking at the mental health aspects of Trikafta. Did that answer your question?
Yeah, thanks. I'll be interested in kind of keeping track of how
Okay. Okay, perfect. And that's one of the reasons why they're looking at that first one that we talked about with Vertex. It's just the 1 pill a day. Anybody else? Don't be shy. I don't bite. Plus, I can't reach you if I could. Okay, Marion, you want to go to the next? Oh, well, I guess I should talk about the blue there on there. The first one, the MS-1819, has actually been named now. It's adrulipaz, and it's actually for patients who have a pork enzyme. Oh shoot, if you're pork enzyme allergy. So it's a non-animal derived enzyme for some of our patients who do have to do enzymes, who have a pork allergy. And then the Anagram Therapeutics with the Cirspira, that's also a non-animal derived enzyme, and it may improve dosing so that they're not going to have to take that handful of enzyme pills as they have in the past, that it may just be one at each meal instead of a whole handful. So that's going to be really good for our patients. Okay, Maren, you want to go to the next slide? Okay, I talked a little bit about this. This is our infection research initiative. We had committed to 100 million by 2023, and we're already at 135 million. So we've kind of done what we said we were going to do. And we've developed a lot of this through input from our CF community. So we're really looking at optimizing therapies that we're already doing. We're actually looking more at the microorganisms. So that would be the Pseudomonas, the NTM infections. We're also looking at the long-term antibiotic use, and that's when we were talking about the hearing loss for some of our patients. We're trying to improve detection and diagnosis of the patients who may have those infections. Of course, the future of CF infection is, wide open, because we do want to make sure that we're keeping our patients as healthy as possible for that next step. So, Mary, if you want to go to the next slide. So this is just a little bit about some of the drug companies that we're working on with some of the infections. And if you look at Pseudomonas, we probably have more patients or more pharmaceutical companies working with Pseudomonas. NTM's a little bit harder to deal with, but we still have quite a few people that we're working with. Multi-pathogens would be more than one infection. Of course, MRSA, a lot of you have heard about MRSA, fungal infections, pulmicide, which we do have. And then the Sound Pharma is working on the hearing loss, and then B. cepacia is Calibra. So that's just a little bit about some of the drug companies that we're working with. And then if you look at this slide, which it's a little bit busy, but I just kind of wanted to show you where a lot of our, which I don't know why it cut it off. And I forget my computer doesn't move with my fingers anymore. But the second one is preclinical, and then we're going into phase 1, phase 2, phase 3. So we're showing we have a lot of things in progress if you kind of look at it that way. There's 24 active programs that we're working with. Phage therapy. So this is really something that we're going to have to look at. We have 2 companies that we're working at with phage therapy right now, and they have registered clinical trials, and they're actually in almost phase 3 studies, and it's showing a lot of promise. So if you'll go to the next slide. And basically what a bacterial phage is, it's just a virus that can infect and kill the bacteria that's already in the body. And so what we're having to do, though, is some patients may have a Pseudomonas infection and then have another infection as well. So what they're doing is doing a cocktail approach. So they're combining several different viruses per patient to inject into the system. The only problem that we have right now is it looks like it's going to have to be more than once a month. So they're working on trying to figure out how to make that work better. If you'll go to the next one, Maren. So the cocktail approach is probably the most effective way to beat that rapid resistance. And then fixing it for patients that have the same combinations of infections. And then we may even have to have personalized medicine for phage therapy. And we keep a library of viruses in place that we know will kill a particular strain of bacteria, which I think is kind of cool to have a library of viruses, which is cool and scary at the same time. Next slide, Maren. Oh, I didn't realize that was my question slide already. I've talked too fast.
Oh, good.
So this is y'all's chance to ask questions. If there's anything else you might want to know more a little bit about. I know the group with, was it Claire that has a whole group with her?
Yeah.
Claire said they had a list of questions. Claire, y'all ready to hit me? There they are. Oops. We lost you again, Claire.
Sorry, could you go into some more information about the Petri dish? And that, did you say CF was cured in it?
Oh,
That was brought up at NACFC in the plenary session the first day. They said that they could cure CF in a Petri dish. The problem with that, though, is that's not in the body. And one of the biggest concerns that they have is what they call a vector. And so they have to get the gene into the body. So they have to find different vectors, and that could be a fat, like a little fatty glob to be able to get that vector into the system. With CF, there's so many different organs that they're going to work on the lung first. And so what they're finding is when they put something in that's kind of what you could say an outsider, the body fights it off. So that's the biggest issue, is trying to find a vector that can get it in there, get it corrected, and then make it work. So that's the biggest issue. That's why when they said they could do it in a Petri dish, that's amazing, but we still have a long way to go before we can actually make it work in the body. Does that make sense?
Is that the same line then as the CRISPR?
They are. The CRISPR is part of this process where they can put an enzyme in, cut it, put a new gene, but they have to be able to get that new gene into the system without the system rejecting it.
Mm-hmm.
It's kind of like having an old used car and you're putting a new part in it. It doesn't always work as well. So that's kind of what we're kind of our challenge is.
Yeah.
Fascinating.
Any other questions? Is that all you had, Claire? I thought y'all would have a whole list.
No, I think you covered a lot of stuff for them.
Okay. Well, as I get NACFC highlights,
Yeah.
and a lot of that's not published yet. I just got the patient data registry today from NACFC. So that's why I kind of updated those numbers on my slides, because I'd done those in October with the age and the number of patients and then the pregnancies as well. But as I get information, Maren has a list of people who are on the call, so I can send to Maren and then she can distribute it out to you guys, because I don't have everybody's email. I don't think. The only one I know I have is Charles's.
Yeah. The other thing we can do too is the foundation will certainly put out in a kind of a recap, like Brian's saying too. And the website is obviously very useful, but we can make sure you are directed to that information so you can get.
And I get today's headlines every day, and sometimes I don't even have a chance to read them. But today's headlines just had the patient registry report, and it didn't have some of the other NACFC. And I know that one of the interesting things from the conference this year, which at first I was sitting there going, why do we have somebody talking about sickle cell anemia? But what it was is they were showing that gene therapy is working. They actually have cured people with sickle cell anemia. And what they've done is they've taken cells out of their bone marrow, added new genetic material to them in layman's words, because it was way over my head. They kind of shook it up a little bit, got them to mix together, and then they gave the patients radiation to kill the other cells that are in their bone marrow, and then they injected the new and improved ones back into their systems, and it's causing a cure. So we know that the method is going to work. It's just going to take us longer with CF because there's so many things that are affected with CF. That's why we're going to work with the lungs first. Yeah. Not that that's the easiest, but that's probably the best vector to work with.
Brian, I know individual giving is your role. Can you talk to us a little bit about ways that we can kind of identify need in the science realm when we're talking about fundraising, and how we can kind of bring that into our conversations?
Yeah. Well, one of the things that we have to realize that TRICAPTA cost us a lot of money. Mm-hmm. We did a Milestones 1 program for $175 million and a Milestones 2 program for $75 million. We went over both of those goals. We're not very creative on our naming, so we're in a Milestones 3 campaign right now. But we know that genetic therapies are probably going to cost 10 times more than what it cost us to get to TRICAPTA. So our goal for Milestones 3 is $200 million. And there's different aspects about this Milestones program this time. Of course, our chair is still the same, Joe O'Donnell. So if you've got a successful volunteer, stick with him. And he's actually doing our Milestones 3 campaign. But he's doing it a little bit differently. He's doing it more like the colleges do, with the legacy component to it, so that we can plan for the future. For example, my wife and I are both legacy donors, but we haven't disclosed because we did percentages in our will. So you can leave a gift through your will, your 401k, your life insurance policy. I actually met somebody I've been in so many cities. I have 19 offices. I think it was Denver. I guess he's about 40. He actually bought a life insurance policy, and his beneficiary is CF Foundation. So his life insurance premiums are like $40-something a month, but it's like $100,000 life insurance policy. So that's going to go to CF. So Joe has made it where it's a combination of a major gift and also a legacy component to that. And some people are disclosing how much they're going to leave us in the future. Some people are just telling us they're legacy donors. And for Milestones 3, any gift over $10,000 is considered a major gift.
Mm-hmm. Yeah, thanks for that. I think in my fundraising, there's so much positive feedback with TRICAPTA, and that's incredible. And that's happened because of donors. And I think even post-conference, just hearing everything that the foundation is doing research-wise and the steps they're taking, to me it feels like such a important time to push fundraising towards that effort.
It really is. And I mean, every dollar counts. I mean, every Great Strides team, every cycle event, every gala that you attend, I mean, it's so important, and just getting the word out. I mean, because we actually put our money behind what we say we're going to do. We put it into research, and it's when you see the pipeline and all that we've accomplished, we're putting our money where we say we're going to put it. So we used to be able to say we spend, 90 cents on every dollar. We can't say that anymore, but we do put a lot of what we raise back into the foundation, into research.
Yeah. I think someone from Claire and Shelby's group had a question.
Okay.
I just have a question about the CF related diabetes.
That is a big push for us, because with our older population now, that seems to be a function of that. So we are really looking at CFRD. I actually looked at I went to 2 sessions on cystic fibrosis related diabetes while I was at NACFC, and I was tracking with them for the most part, but then they went over my head. So I'm hoping that I can read through that again once I see that information. But that is a big push for us, and also liver disease. So liver disease and CF related diabetes are going to be a big push, and there's going to be some clinical trials working on those as well. I
Well,
didn't
and then
interrupt you. Sorry.
with the liver disease, that I know that the Trikafta impacts the liver with some of the candidates taking that, and that will decreasing the amount of Trikafta, like you were talking about, will that help address that?
I think, remember, I'm a layman. I think once you have liver damage, you can't get that back. But I will follow up to make sure that's true. I know that Dr. Narkowitz, who is in Denver, Colorado, is the specialist for liver disease with patients with CF. And so that'll be something I can send him a quick email about.
Yeah, that'd be great.
Thank you.
Uh-huh.
Brian, I have another question. You mentioned the difficulty in finding people to do clinical trials. Do you know what, the reason for that is, and if there's, ways the foundation can help connect people?
Well, what we're doing is in Alabama, which is a huge research area. Dr. Rowe, Stephen Rowe, was the director in Alabama in Birmingham. I know Dr. Rowe really well. He is now our chief science officer, who, if anybody's going to find a cure for us, he's going to do it. He's the smartest man I've ever met. Dr. Solomon, Marty Solomon, is now the director of the UAB clinic, and they are one of the largest therapeutic development centers for us for clinical trials. And what the problem is with the clinical trial being somebody that doesn't have Delta F508, that limits the population. Yeah. So let's say we have 40,000 people in the United States that have CF. Only 4,000 of them probably have 2 nonsense mutations or 2 stop mutations or 2 X mutations. So they're having a smaller pool of people that they can pull from. Right. So they may have to do therotyping, which is we might get some genetic material from a patient who's actually not in person to do the clinical trial. But what they're doing in Alabama is we're now putting the feelers out for Alabama, Georgia, Mississippi, Tennessee, and Texas, so that we are doing that. And then I was on a call yesterday with, where was it? Gosh, this is pretty bad. I can't remember who my call was with yesterday. Anyway, Dr. Fulmer was saying that they actually are paying for referrals. They're funding referrals from the center so that they can get patients to sign up for these clinical trials. So that's some of the things that their hospital is doing, is they're actually funding referrals.
Wow. Any other questions from anyone? All right. Well, Brian, anything else you want to add, or?
I can't think of anything, but seriously, y'all, if you get off, if you get off the call and you think, why didn't I ask him that? Or you were too shy to come off camera or off mute, just shoot Maren an email, because she's got your email addresses since she sent the invite, and just send her an email and ask her, and then I'll make sure to follow back up with you. And I apologize, I couldn't remember who I was on the phone with yesterday, but it was Austin, Texas. Yeah. So Dr. Jason Fulmer is in Austin, and he was the one that said that their hospital is actually doing a referral program where they fund people to be in the clinical trials.
Okay. Very cool. Well, good. Well, thank you so much for your time, Brian. Thanks.
Oh, you're very welcome.
Yeah, it's a lot of exciting things happening, and it
really is. I mean, it's the best time in the world. And I can't remember who it is whose birthday was in June. Was it Jackie's grandchild?
Oh, I can't remember.
I mean, this
Yeah, it
is the
was
best
Jackie's
time in the
and
world to
mine.
be born with CF, to be honest with you, because we have so many other patients, like Amy, that David's daughter, she didn't get on Trikafta till she was in her late 30s.
Yeah.
So with our patients now, I have some twins in Alabama actually, who have a rare mutation and then a Delta F508 mutation. They went on Trikafta. They both had different symptoms because with twins, they're fraternal twins. One of them presents more with the Delta F508 gene, and the other one presents with the rare mutation. So
Wow.
the young man who had the Delta F508 more as the dominant strain of his two, he coughed up all kinds of phlegm after they started taking Trikafta, and it just really upset the parents because they were like, we have done everything we could possibly do. Why did he have so much stuff in his lungs? The other son broke out in hives, never threw up anything. So they both presented completely different, but now they're doing great.
Yeah.
So, I mean, it's amazing to me to see the differences. But Trikafta has just been a game changer for so many people. And, I have a good friend who has CF who used to live in Tennessee, and now she's moved to Louisiana. And Louisiana is part of my territory too. And I would always call her and I'd say, hey, I'm coming into town. Do you want to meet for dinner? I don't feel good. And I knew she was on a trial, and I knew she was on the Trikafta trial, but apparently she was on the placebo, so she wasn't getting the drug. And so then when they made it open label, she got put on Trikafta. It was amazing. I called her, this was just before COVID, or right after COVID, or 2020. I've lost 2 years of my life. I called her. She said, I'll pick you up at the hotel. And I'm like, really? So I opened the car door. I started crying. She looked the best I'd ever seen her in her life. I mean, she looked amazing. She put on weight. And we went to dinner, and I told her, I said, do you realize you haven't coughed at all? I said, and I've even told you jokes, and you haven't, started coughing after you started laughing. So, I mean, it was just being able to see the physical difference. And then for her to say, I'm going to go back to work. I mean, it's just amazing what Trikafta has done for some of our patients. Yeah. But we still have some kinks to work out with the liver and the mental health, but we'll get there.
Yeah. Well, great. Well, thank you so much, Brian. We really appreciate it. It's an exciting time, and it's nice to have someone kind of speak to us down at our level and kind of hear what's going on. And those of you that joined the call, thank you for being here. We've really loved these Grampions meetings, and we're going to keep doing them. So keep your eye out for the beginning of next year. We'll kind of put a plan together to do some of these informational sessions again. And just know how much we appreciate you and what you're doing for your loved ones, your family members. You're such an important part of our community, and we're grateful for you. So
I would like to send my...
Brian.
Oh, sorry.
We really
Connie.
appreciate everything you guys are doing.
Oh, thank you.
Great.
Connie, did you have something you wanted to say?
I would like to thank you for what you're doing and for these presentations. It's very informative.
You're very welcome. Hopefully you will ask me back. Hopefully I haven't scared you away. No. And Charles, it's always good to see you. Thanks for being on the call. And thank you everybody for being here and letting me be part of the Grampions. And one thing that I've told people too is just because you're not a grandmother or a grandfather, a Grampion is just a champion of somebody with CF. So just remember that. Y'all are all champions, and I appreciate everything you're doing each and every day.
Yeah. All right. Thank you, everyone. Enjoy the rest of your evening, and we'll be in touch.
Thank you.
Thank you.
Bye.